vitamins, applied nutrition and dietetics. Look at this picture, shows that fruits, vegetables, vitamin rich food items. A detail going on. Contents: 1. Introduction. 2. Classification. 3. Fat soluble vitamins, functions and dietary sources. 4. Water soluble vitamins, functions and dietary sources. 5. Requirements, RDA of every vitamins. 6. Vitamins related diseases. 7. Application and implication to nursing. 8. Conclusion. Introduction. Vitamins play a crucial role in nursing care as they are essential for maintaining patients' overall health, aiding in recovery and preventing deficiencies that can lead to various health complications. Nurses need to assess patients' dietary intake and ensure they receive adequate vitamins through diet or supplements. Especially in population at risk, such as the elderly or those with chronic illness. Proper education on vitamin intake and monitoring for signs of deficiency or toxicity are essential components of nursing practice to promote optimal patient outcomes. Define vitamins. Vitamins are organic compounds that are essential in small amount for various bodily functions, including growth, immunity, and metabolism. They cannot be synthesized in sufficient quantities by the body and must be obtained through diet or supplements. Each vitamin has specific roles, and deficiency can lead to various health problems. 2. Classification. Vitamins are essential micronutrients that our body needs in small amounts to function correctly. They are classified into two main categories based on their solubility. 1. Fat soluble vitamins, and 2. Water soluble vitamins. Look at this flow chart. Vitamins classification: fat soluble, water soluble. Fat soluble including vitamin A, D, E and K. Rose in color essential vitamins. Look at this. And blue in color non-essential vitamins. Water soluble classified into vitamin C and B vitamins. B vitamins including B1, B2, B3 B5, B6, B7, B9, B12. Detail about fat soluble vitamin. Fat soluble vitamins are absorbed along with fats in the diet and can be stored in the body's fatty tissues and liver. They are generally excreted more slowly than water soluble vitamins. The four fat soluble vitamins are vitamin A, retinol, functions vision, immunofunction, reproduction and cellular communication. Sources: liver, fish oils, milk, egg and colorful fruits and vegetables. Beta carotenes. To vitamin D, calciferol, functions bone health by regulating calcium and phosphorus absorption, immunosystem support. Sources: sunlight exposure, fatty fish, fortified dairy products and egg yolks. Vitamin E, tocopherol, functions antioxidants that helps protect cells from damage, immunofunction and skin health. Sources: vegetable oils, nuts, seeds and green leafy vegetables. 4. Vitamin K, functions blood clotting, bone metabolism and regulating blood calcium levels. Sources: leafy green vegetables, fish, meat and dairy products. Second, water soluble vitamins. Detail going on. Water soluble vitamins dissolve in water and are not stored in the body to any significant extent. They must be consumed regularly in the diet. The water soluble vitamins include the B complex vitamins and vitamin C. One, vitamin C, ascorbic acid, functions antioxidants, collagen synthesis, wound healing, immunosupport and absorption of iron. Sources: citrus fruits, berries, melons, peppers, dark leafy green and tomatoes. Two, B complex vitamins. Vitamin B12, thiamine, functions energy metabolism, nerve function. Sources: whole grains, pork, legumes and seeds. Vitamin B2, Riboflavin, functions energy production, cellular function and metabolism of fats, drugs and steroids. Sources: eggs, organ meats, lean meats, milk, and green vegetables. Vitamin B3, niacin, functions DNA repair, production of stress and sex hormones, energy metabolism, sources meat, fish, poultry, and whole grains. Vitamin B5, Pantothenic acid, functions synthesis of coenzyme A, hormone production, and fat metabolism, sources chicken, beef, potatoes, oats, and tomatoes. Vitamin B6, Pyridoxine, functions protein metabolism, cognitive development, and production of neurotransmitters, sources fish, beef liver, potatoes, and non-citrus fruits. Vitamin B7, biotin, functions metabolism of fats, carbohydrates, and proteins, gene regulation, sources eggs, almonds, spinach, and sweet potatoes. Vitamin B9, folate, folic acid, functions DNA synthesis, repair, and methylation, red blood cell formation, sources leafy greens, legumes, seeds, and fortified grains. Vitamin B12, cobalamin, functions nerve tissue health, brain function, and red blood cell production, sources fish, meat, poultry, eggs, and dairy products. Fat soluble vitamins A, D, E, K, stored in the body's fat tissue. Water soluble vitamin C and B, complex vitamins not stored in the body and need regular intake. Three fat soluble vitamins, functions and dietary sources. One, vitamin A forms retinoids, preformed vitamin A found in animal products, carotenoid, provitamin A found in plant products can be converted into retinoids in the body. Functions vision, essential for maintaining the health of the retina, particularly in low light conditions. Immunofunction supports the production and functions of white blood cells, cell growth involved in cellular communication, growth, differentiation. Skin health, maintain epithelial tissues. Sources: retinoids, liver, fish oil, milk, egg. Carotenoids, carrots, sweet potatoes, spinach, cauli, and other colorful vegetables and fruits. To vitamin D, calciferols forms D2, ergocalciferol found in some plant foods, D3, cholecalciferol synthesized in the skin upon exposure to sunlight, also found in animal products. Functions: calcium absorption, enhances the absorption of calcium and phosphorus from the gut. The bone health, crucial for bone growth and remodeling. Prevent rickets in children and osteomalacia in adults. Immunofunctions: modulates immunoresponse. Sources: sunlight exposure. Fortified foods: milk, orange juice, fatty fish, salmon, egg yolks, and liver. Vitamin E, tocopherols and tocotrienols forms. Tocopherols, alpha tocopherol is the most active form in humans. Tocotrienols less common but also pose vitamin E activity. Functions: antioxidants, protect cell from oxidative damage by neutralizing free radicals. Immunofunction, enhancing immunoresponse. Skin health, helps maintain healthy skin and eyes. Sources: vegetable oil, wheat, green, sunflower, safflower, nuts and seeds, almonds, sunflower seeds, green leafy vegetables, spinach, broccoli. 4. Vitamin K, phyloquinine and menoquinous. Forms: K1 found in plant foods, K2 produced by bacteria in the human gut and found in fermented foods and some animal products. Functions: blood clotting, essential for the synthesis of proteins required for blood clotting, coagulation. Bone metabolism regulates calcium bindings in the bones, which is crucial and critical for maintaining bone density. Sources: K1 green leafy vegetable, spinach, broccoli. K2 fermented foods, dairy products, meats. Fat soluble vitamins A, D, E, K are vital for various body functions including vision, bone health, immunofunction, and blood clotting. They are stored in body's fat tissues and liver, making it essential to consume them in appropriate amounts to avoid deficiencies and potential toxicities. For water soluble vitamins, functions, and dietary sources. Water soluble vitamins dissolve in water and not stored in the large amounts in the body, so they must be consumed regularly through the diet. They are excreted in urine, which reduces the risk of toxicity but necessitates frequent intake. Vitamin B1, thiamine. Functions: energy metabolism, help convert carbohydrates into energy. Nervous system, supports nerve function and neurotransmitters synthesis. Sources: whole grains, pork, legumes, seeds, nuts. Vitamin B2, Riboflavin. Functions: energy production, involved in energy production through the oxidation reduction reactions. Skin and eye health, maintains healthy skin and eyes. Sources: milk, egg, green leafy vegetables, nuts. Vitamin B3, niacin or nicotinic acid forms nicotinic acid and nicotinamide. Functions: energy metabolism, essential for converting food into energy. DNA repair and synthesis, involved in DNA repair and the synthesis of steroid hormones. Sources: meat, fish, poultry, whole grains, enriched breads, nuts, etc. Vitamin B6, Pyridoxine forms pyridoxine, pyridoxal and pyridoxamine. Functions: amino acid metabolism, involved in amino acid metabolism and neurotransmitter synthesis. Hemoglobin production, essential for hemoglobin production and immunofunction. Sources: poultry, fish, potatoes, chickpeas, bananas. Vitamin B5, pantothenic acid. Functions: coenzyme A synthesis, essential for the synthesis and metabolism of proteins, carbohydrates and fats. Hormone production, involved in the production of hormones and cholesterol. Sources: almost all foods contain some pantothenic acids, but especially high in chicken, beef, potatoes, oats, tomatoes, liver, egg yolks. Vitamin B9, folic acid or folate. Functions: DNA synthesis and repair, critical for DNA synthesis and cell division. Red blood cell formation, essential for the formation of red blood cells. Sources: green leafy vegetables, legumes, nuts, seeds, and fortified grains. Vitamin B12, cobalamin. Functions: nerve functions, essential for nerve tissue health and brain function. Red blood cell formation, works with folic acid in red blood cell formation. Sources: animal products such as meat, dairy, eggs, and fortified plant-based milks. Vitamin C, ascorbic acid. Functions: antioxidants, protect cells from oxidative stress. Collagen synthesis, crucial for the synthesis of collagen, which is important for skin, blood vessels and wound healing. Immunofunction, enhance immune response. Sources: citrus fruits, orange, lemons, strawberries, kiwi, bell peppers, broccoli. Water soluble vitamins including the B vitamin complex and vitamin C play a crucial role in energy metabolism, red blood cell formation, immunofunction and cellular maintenance. Because they are not stored extensively in the body, it is important to consume them regularly through a balanced diet rich in fruits, vegetables, grains, and proteins. Five requirements RDA of every vitamins. Here are the recommended dietary allowances and adequate intakes for vitamins and established by the Food and Nutrition Board of the Institute of Medicine, now part of the National Academy of Medicine. These values represent a daily intake levels sufficient to meet the nutritional needs of most healthy individuals. Fat soluble vitamins, vitamin A, RDA. Adult males 900 micrograms per day. Adult females 700 micrograms per day. Pregnant females 770 microgram per day. Lactated females 1300 micrograms per day. Vitamin D, RDA. Adults up to 70 years 600 international units IU per day. Adult over 70 years 800 IU per day. Pregnant and lactating females 600 IU per day. Vitamin E, RDA, adult 50 mg. Alpha tocopherol per day. Pregnant and lactating females 50 mg per day. Vitamin K, AI, adequate intake. Adult male 120 microgram per day. Adult female 90 microgram per day. Pregnant female 90 microgram per day. Lactating females 90 microgram per day. Water soluble vitamins. Vitamin B1, thiamine, RDA, adult males 1.2 mg per day. Adult females 1.1 mg per day. Pregnant females 1.4 mg per day. Lactating females 1.4 mg per day. Vitamin B12, Riboflavin, RDA, adult males 1.3 mg per day. Adult females 1.1 mg per day. Pregnant females 1.4 mg per day. Lactating females 1.6 mg per day. Vitamin B3, niacin, RDA, adult males 60 mg niacin equivalents Ne per day. Adult females 14 mg Ne per day. Pregnant females 18 mg Ne per day. Lactating females 17 mg Ne per day. Vitamin B6, Pyridoxine, RDA, adult males 1.3 to 1.7 mg per day. Varies by ages. Adult females 1.3 to 1.5 mg per day. Pregnant females 1.9 mg per day. Lactating females 2.0 mg per day. Vitamin B5, Pantothenic acid, adequate intake AI, adults 5 mg per day. Vitamin B9, folic acid, RDA, adult 400 mcg, micrograms. Dietary folic acid equivalent DFE per day. Pregnant female 600 mcg DFE per day. Lactating female 500 mcg DFE per day. Vitamin B12, cobalamin, RDA, adult 2.4 mcg per day. Pregnant females 2.6 mcg per day. Lactating females 2.8 mcg per day. Vitamin C, ascorbic acid, RDA, adult males 90 mg per day. Adult females 75 mg per day. Pregnant females 85 mg per day. Lactating females 120 mg per day. Meeting these recommended intake levels through a balanced diet ensures adequate vitamin status for most healthy individuals. Pregnant and lactating women have higher requirements for certain vitamins to support fetal development and milk production. It is important to note that individual needs may vary based on factors such as age, sex, health status, and lifestyle. Six, vitamins related diseases. Water soluble and fat soluble vitamins play a critical role in maintaining health, and deficiencies or excess of these vitamins can lead to various diseases. Here is detailed list of diseases related to deficiencies and excess of water soluble and fat soluble vitamins. First, water soluble vitamins. 1. Vitamin B1, Thiamine. Deficiency disease, beriberi. Symptoms, weight loss, emotional disturbances, impaired sensory perception, weakness, pain in the limbs, and periods of irregular heart rate. Types: Bet beriberi affects cardiovascular system, and dry beriberi affects nervous system. 2. Vitamin B2, Riboflavin. Deficiency disease, riboflavinosis. Symptoms, sore throat, redness and swelling of the lining of the mouth and throat, cracks or sores on the outsides of the lips and at the corners of the mouth, inflammation and redness of the tongue, Three, vitamin B3, niacin. Deficiency disease, pellagra. Symptoms, dermatitis, diarrhea, dysmenorrhea, and if left untreated, death. causes can also be caused by a deficiency in tryptophan, an amino acid that the body can convert to niacin. For vitamin B5, Pantothenic acid deficiency disease rare but can cause symptoms like irritability, fatigue, apathy, numbness, paresthesia, and muscle cramps. Symptoms: fatigue, depression, irritability, vomiting, stomach pains, burning, feet syndrome, and upper respiratory infections. 5. Vitamin B6 Pyridoxine deficiency disease, pyridoxine deficiency. Symptoms: dermatitis, glossitis, inflammation of the tongue, depression, confusion, convulsion. 6. Vitamin B7 biotin deficiency disease, biotin deficiency. Symptoms: hair loss, skin rashes, brittle nails, neurological symptoms such as depression, lethargy, hallucinations, and numbness in the extremities. 7. Vitamin B9 folate deficiency disease, megaloblastic anemia. Symptoms: fatigue, headache, pallor, shortness of breath, and gastrointestinal symptoms like diarrhea. During pregnancy, increased risk of neural tube defects in the fetus. 8. Vitamin B12 cobalamin deficiency disease, pernicious anemia. Symptoms: fatigue, weakness, constipation, loss of appetite, weight loss, and neurological changes such as numbness and tingling in the hands or feet. Long-term deficiency can lead to severe neurological issues like memory loss and dementia. 9. Vitamin C Ascorbic acid deficiency disease, scurvy. Symptoms: anemia, debility, exhaustion, spontaneous bleeding, pain in the limbs and especially the legs, swelling in the some parts of the body, and sometimes ulceration of the gums and loss of teeth. Fat soluble vitamins: 1. Vitamin A retinol deficiency disease, night blindness, and xerophthalmia. Symptoms: impaired vision, particularly in low light, night blindness, and dry eyes, which mean xerophthalmia. Excess hypervitaminosis A can cause liver damage, headache, nausea, and in severe cases can lead to increased intracranial pressure, coma, and death. 2. Vitamin D, calciferol deficiency disease, rickets in children, and osteomalacia in adults. Symptoms in children's rickets: bone deformities such as bowed legs, thickened wrists and ankles, and breastbone projection. Symptoms in adults: osteomalacia, bone pain, muscle weakness. Excess hypervitaminosis D can lead to hypercalcemia, result in nausea, vomiting, weakness, and serious complications like kidney damage. Three. Vitamin E, tocopherol deficiency disease, rare but can cause peripheral neuropathy, ataxia, skeletal myopathy, retinopathy, and impairment of the immunoresponse. Excess can interfere with blood clotting, leading to can increase risk of hemorrhage. For vitamin K, phyloquinine and manaquinine deficiency disease, bleeding, diathesis, tendency to bleed. Symptoms: easy bruising, excessive bleeding from wounds, punctures and injections, and heavy menstrual bleeding. Excess, rare but high dose can cause hemolytic anemia and jaundice in newborns. Understanding the role and potential problems associated with these vitamins helps in diagnosing and treating related conditions effectively. Regular, balanced nutrition can prevent most of these deficiencies. Seven. Vitamins, its application and implication to nursing. Detail going on. Vitamins play critical role in health and wellness, and their application and implication in nursing are significant across various aspects of patient care. Here is how vitamins are relevant in nursing practices. 1. Assessment and screening. Nurses routinely assess patients for nutritional status, including vitamin deficiencies, through patient history, physical examination, and possibly laboratory tests. Nurses identify symptoms and signs that may indicate vitamin deficiencies or excesses. This assessment helps in early detection and intervention. Second, education and counseling. Nurses educate patients and families about Importance of balanced nutrition, including adequate intake of vitamins. This education includes promoting a balanced diet, encouraging consumption of foods rich in vitamins to meet daily requirements. Special populations providing tailored advice to pregnant women, breastfeeding mothers, infants, elderly patients who may have specific vitamin needs. Supplementation, educating on the use of vitamin supplements when necessary, ensuring safe and effective use. 3. Prevention and health promotion. Nurses play a crucial role in preventive care and health promotion related to vitamins. Antenatal and prenatal care, ensuring patient women receive adequate folic acid and vitamin D to prevent birth defects and promote fetal development. Geriatric care, preventing vitamin D deficiency in elderly patients to maintain bone health and prevent falls and fractures. For patient management and treatment, vitamins are often used in patient management and treatment plans. Treatment of deficiencies. Administrating vitamins or supplements to correct deficiencies, example, vitamin B12 injections for pernicious anemia. Supportive care, using vitamins to support patients undergoing treatments that may deplete vitamin stores. Example, vitamin C for wound healing in surgical patients. Chronic conditions, managing chronic diseases where specific vitamins play a role. Example, vitamin D in osteoporosis management. Five, monitoring and evaluation. Nurses monitor patients for response to vitamin therapy, assessing effectiveness, monitoring clinical indicators and laboratory results to evaluate the impact of vitamin interventions. Safe monitoring. Monitoring for signs of vitamin toxicity or adverse effects. Six, collaboration and advocacy. Nurses collaborate with multidisciplinary teams to ensure holistic patient care. Consultation, consulting with dietitians, pharmacists and physicians regarding vitamin prescription and management. Advocacy, advocating for patient access to appropriate vitamin supplements and nutritional support. 7. Documentation and communication. Accurate documentation of vitamin intake, supplementation, and patient response is essential. Communication, providing clear and concise information to other healthcare providers regarding vitamin related assessments, interventions, and outcomes. Eight ethical and legal considerations. Nurses adhere to ethical principles and legal standards related to vitamin administration and patient care. Informed consent. Ensure patients are informed about risk and benefits and alternatives related to vitamin therapies. Scope of practice. Operating within the nurse's scope of practice regarding vitamin administration and monitoring. Vitamins are integral to nursing practice across all healthcare settings, from preventive care and patient education to treat and management of vitamins related health issues. Nurses play a vital role in promoting optimal nutrition, ensuring safe and effective use of vitamins in patient care. Conclusion. In applied nutrition and dietetics for nursing, understanding the roles and requirement of vitamins is crucial for promoting optimal patient health and wellness. Nurses utilize this knowledge to assess nutritional status, educate patients on dietary choices that support vitamin intake, and implement interventions to prevent and manage deficiencies, thereby contributing to comprehensive and effective patient care. This holistic approach ensures the patients receive tailored nutritional support to enhance recovery and overall well-being. Thank you. Have a nice day.